Since the calcium has bonded to the troponin, the tropomyosin moves, which exposes the actin binding sites. ATP is then used to put the myosin heads in a high energy configuration where they form a cross bridge with the actin. They then relax into a low energy configuration, pulling the actin with it. Then ATP is used to break the cross bridge. Also, ATP is used to actively transport calcium across the sarcoplasmic reticulum. During rigor mortis, if, for example, a squirrel gets run over by a truck, there is no active transport with ATP to be moving the calcium across the sarcoplasmic reticulum. So then all the calcium floods out of the sarcoplasmic reticulum at once. They then all bind to the troponin, exposing all the actin binding sites by moving the tropomyosin. Normally, all the actin binding sites are not exposed. Also, since there is ATP in the cell from mitochondria, there's enough ATP to move all the myosin heads into a high energy configuration where they all bind to an actin binding site. They then relax. However, now there is not enough, there's no ATP left to break these cross bridges with the actin and the myosin. So the muscles stay this way with the actin being pulled in by the myosin. This causes an overall effect of the muscle stiffening, and it will stay this way until things such as bacteria break it down.